Hello, my name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Vermont Department of Health District Director Judy Ashley and Dr. Deanne Haag of Northwestern Pediatrics. These two women are here to talk about a Rise Vermont initiative that measures the long-term health improvements we're making in our communities. Wow, sounds transformational to me.
It is.
That's fantastic. Thank you both for being here to talk about this initiative. But first, I know you've been on the show before. It will be great for the community just to be reminded who you are and what you do.
So I'm Deanne Haag, and I'm a pediatrician that's been in the community for 15 years now. Yes, I'm a Southern Vermonter myself, so I didn't go far.
Terrific.
And I'm Judy Ashley. I'm District Director for the Health Department. The state of Vermont has 12 district offices around the state, corresponding pretty roughly with counties. And ours is Franklin and Grand Isle County. We have a staff of 14 people. We have nurses, nutritionists, administrative staff, emergency preparedness folks, people who deal with alcohol and drug abuse prevention. So we're active and we're in the community, and I oversee that office.
That's terrific. And it'll be exciting to hear what brings the two of you together on this show.
Yeah.
So this is an initiative we're going to talk about, and we're going to talk about a partnership with the schools, and it's under Rise Vermont, correct?
Yes.
So, Judy, do you want to just mention what is Rise Vermont, and then we can jump right into this school initiative?
Sure. Well, we're hoping by now that people know what Rise Vermont is.
I know, we're everywhere.
Yes, we're everywhere. And it is a collaborative, a public-private partnership with the health department and the hospital. And it's been going on, I think we launched 2 years ago, but we did some planning before that. So we're in the community, and really the tagline is communities embracing healthy lifestyles. We want all of our communities to be healthy, and so we're engaged out in the communities through a variety of ways. And this is one of the ways that we're going to talk about, is working with the schools is an additional way that we can be able to look at and measure how well we're doing.
Fantastic. That was a great summary. Thank you. Okay, we're set now to talk about the school partnership. So who wants to start the conversation of what is it?
You want me to go? Okay, so really what it is we are aligned with an international company called EPOD. Well, not a company, I guess, an initiative, a movement over that we have got involved with about preventing childhood obesity. Together we prevent childhood obesity. As part of what they do, they collect data measurements of children in schools to see how effective their work is in the community. And Rise Vermont was scored very high by them in what we've been doing, and very similar to what's happening over in Europe. So we are engaging this fall, in a few weeks, collecting measurements of children in schools.
Really?
Yes.
So what does that entail?
We're looking at height and weight measurements, and I can go into detail on that if you want me to. But we've gotten approval by the University of Vermont Institutional Review Board to do this, which is a group that oversees working with human subjects. Now that sounds really scary when I say that, but it's not. It's basically,
It's quite simple.
It is. Well, it is quite simple, but we've had to do a lot to show that we aren't going to do anything that's going to hurt the children or anything like that. So we'll be working in the elementary schools. We're looking at grades 1, 3, and 5. And we've had great response from all of our schools. The superintendents have been very supportive of what we've been trying to do.
All the schools in Franklin and Grand Isle?
All the schools in Franklin and Grand Isle County.
Congratulations, that's fantastic.
Yeah.
It's real collaborative, nice.
It is very collaborative. I think the key to this, and I'm going to jump right into it, is the data collection piece. So we do have a data collection form. It will have the child's month of birth and their year of birth and their gender, and the child will put that in there, and with help from the teacher if they need to. Then on the data collection form, you'll also see when the child actually goes to the spot where they're going to have their height and weight measured, which is a very private spot, and only the folks who have been trained by us will be collecting the data. The rest of the data will be looking at which supervisory union are they in, I'm sorry, I'm going to look at the form, the date of the data collection. Then we'll ask the child again, I'm going to see how tall you are and how much you weigh. Are you okay with that? So the child will be able to say, oh, I don't really want to do this, and that's fine. Or they can say yes, they'll do it. Now, the rest of the form is just putting the height and weight in. So the data will be collected. There'll be no names attached to any child.
I was going to ask that. Is the child's name on the form?
No, there's no name at all. So, I mean, and it'll be collected in, it's aggregate's a big word, but basically combining everything together. So, and we'll be reporting out by supervisory union, so there won't be any specific school, like we won't say, well, Georgia Elementary School kids were this, had this
So it'll be rolled up.
It'll be all rolled up together. Thanks,
Okay.
that's a great word, rolled up. Prior to that, though, we have been communicating with all the principals, with all the teachers and staff in the schools, and there's a parent letter that'll be going out very shortly that explains the whole project to the parents, and the parents will have an option of opting out if they don't want their child to participate.
So in that letter to the parents, so what's the why behind this? Why do we do this? Why is this important?
So obesity and childhood obesity in particular can be a huge contributing factor to some of our greatest health risks, heart disease, diabetes, and we want to try to prevent that before it happens. And what's nice about measuring these height and weight parameters in the way that we're doing it is we're calculating something called a BMI, or body mass index, which is not just an indicator for obesity, but an indicator for the risk of obesity.
Okay.
And so we can really put our interventions in the right spot if need be. And also should mention that we have had a group of folks that has been meeting since early February trying to find the best way to do this in a manner that is both respectful of people's needs and in a way that is going to cause the least amount of disruption to schools. And I think they've done a great job of thinking up some ideas for how to do that.
Terrific. And so is this going to be going to each of the schools to do this work?
Yes, we have teams that'll be going to each school. We're working with them right now we have the last 2 weeks in September is when we'll be doing it. And each team will be going to all the different schools in our area.
Okay. That's really amazing. And how many students is that about? Do you think you're going to be?
I think we're about 2,000,
About 2,000.
1,900, yeah, in first, third, and fifth grades.
Okay.
And they're going to be measured using centimeters and kilograms. They're not going to see because that's how the BMI is actually calculated. So if on the off chance someone happens to see a number that they're not supposed to see, it will be harder to interpret because we don't use the metric system very often. So, yes.
So, I'm going to keep going back and forth, but, we talked a little bit about preventing obesity, but obesity leads to other things too. So what type of thing? And we think about the community health needs assessment that we do here, and behaviors make a big difference, and the role that plays, diabetes and things like that. So as a pediatrician, how meaningful is this for a pediatrician or a family practitioner, working with families and what we're trying to prevent? So we talk about it from how it impacts medically.
Sure. Well, I think we all realize that there's a strong correlation between making good, healthy food choices and being active and good health. But I think it's hard sometimes to wrap our head around the why of that and to actually see progress and to see change. And so this is one of those ways that we can help show that there's change from excellent interventions like Rise Vermont programs that are free to the community. And so my hope in doing this would be to share with the public what some of the work that we can do together to help this problem can be.
Yeah. So when you're going to start it, you said in September, and so then what's the frequency? I mean, how do you collect the data beyond year one, and what are your hopes? How long does it take, not only just to do this, but what do you hope for in the future?
Well, measuring change takes a while, especially when you're looking at behavior and culture and things like that. So we'll go back every 2 years. Is the schedule right now to go back in and measure again. And we're not looking at a particular group of students, but just how do we infiltrate in the schools? How do we infiltrate in the communities? We're going to be doing a campaign. It's called a theme campaign in January, which will be looking at active play. And we're going to send that message through basically everywhere you go. You're going to be able to see that message. Whether you're going to the post office, whether you're going to the grocery store, whether you're in the school, whether you're in business, you're going to see messages about active play. And that's going to go on for several months. And that's one of the pieces that we are measuring. Is how, and we know this works, and I'm going to go back to EPO because this is exactly what they've done with the EPO project over in Europe, and they have seen a dramatic decrease in children's weight, obesity, and families because it's a community-based intervention. Yeah. They've tried doing just things in the school and haven't seen much change, but now that this is a real community-based intervention where you're really targeting everybody in the family, all of the family, all of the community, they have seen, because of doing that they've seen a dramatic decrease. So that's what we're looking for, is a dramatic decrease, and hopefully 3 to 4 years, but maybe sooner, we would hope, because RISE has been working and doing things for a couple of years, so we may see some changes in the next iteration of data that's coming out. There are a wide variety of ways we can measure this. There's the Behavioral Risk Factor Surveillance Survey, which measures adults. That's a year-long survey that goes on. It's a national survey for people who are 20 years or older. It's a telephone survey, and it's ongoing. And piece of that is getting weights, heights, and measures on individuals. It's also talking about, do you eat fruits and vegetables? Are you physically active? So that information is collected all the time, so we'll be able to see if we're making any kind of a change, and it probably won't be huge right away, but we're hoping to see some difference. There's also a youth risk behavior survey that's done in the schools. And I believe the majority of our schools are involved with that. And again, it asks questions, the same kind of questions about the number of fruits and vegetables. And so we're hoping to see some change in that area as well. Our office is well known. I mean, most people know the health department for the WIC program, the Women, Infant, and Children program. Yes. And we deal with the population, pregnant women, and then up to 5 years of age for the kids. And we've seen an increase in weight in those children as well. So we'll be able to look at that data and see if we're kind of nudging it down. I mean, right now it's been climbing, so if we can just keep it steady and maybe see some decrease, that would be awesome. So there's a lot of things we'll be able to look at.
There's a lot to be said about zero trend. If you can flatten that curve, and then
that's right.
Versus so
because
that's
we've just seen it climbing in all of those age groups. So we'd like to change that for sure.
That's terrific.
Yeah.
Well, our time is flying, but
really,
what are some of the things? This is so exciting. So thank you so much for taking on this initiative, and the fact that you've got the school systems and you're working with the parents, and this has really become a total community impact. So that's fantastic. A lot of work in this, and so I want to thank you for that. So in closing, maybe some things, what is RISE, what other things are RISE Vermont doing? You mentioned it's community-based, and it's more than measurement, so there's other things that are happening. So what are some of the things that that you see RISE Vermont doing that can impact these results in those 2, 3, whatever, 4 years?
I think one of the most helpful things for me as a physician is all of the programs that RISE Vermont has offered, and most of the time free, actually all of the time free to the community. And so for many of my patients who need ideas about what to do, how to get out there with their kids, how to be active and play and do that safely, it's been fantastic to watch that unfold. The Safe Routes to School program really blossomed under the RISE Vermont umbrella, and I love driving to work and seeing kids walking together to school. It's fantastic to see. So we've seen a lot of great interventions. I think there's more to come. Very exciting things that are happening in the schools. So I appreciate that.
And if we have time, I want to share my favorite story.
Well, why don't you do that, because we are wrapping. So why don't your story will wrap us up, okay?
Okay.
All right.
So part of what we do with RISE Vermont is work with businesses. And we have a scorecard called Business Scorecard. So folks go in and work with a business. And one of the ways to be a gold business, is to be breastfeeding friendly. So when RISE started, my office is responsible for trying to work with businesses and be breastfeeding friendly. I have one staff person to do that. Minimal success. With RISE Vermont, we now have 47 businesses that are breastfeeding friendly.
Wow.
I know.
So what's the difference?
It's Rise Vermont. It's having it on the scorecard. It's talking about it. It's talking to the business about the importance of breastfeeding and women coming back to work, especially having a place for them to either pump or have a place for them to go and breastfeed. Also, just being more welcoming. We have a small business umbrella, which includes a lot of the businesses, especially in St. Albans City, that have less than, I think, 10 employees, and they bonded together. And now if you walk down Main Street in St. Albans, you'll see this is a breastfeeding-friendly business. And women and families can go in and breastfeed there and feel safe and comfortable. And that's a really important piece for starting off the mom and the child to a healthy future.
Yeah.
So it's
fantastic.
I mean, that's just a small piece of the impact that Rise Vermont has had. Yeah.
Fantastic.
It is
a beautiful story to end on.
Yeah.
And again, thank you so much, not only for coming on this show and describing this project in partnership with the schools, but also for your leadership and your work and believing in this community-based approach to embrace healthy lifestyles. It's fantastic.
Yeah, thank you.
Thank you. It's
Yeah.
awesome. Wish we could talk longer.
More to come.
I bet there is. You'll be
Yeah.
back. We can't wait to hear about the results. I'm Jill Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat Show. And we've really got to keep an eye on Rise Vermont, and particularly what's happening in the schools and this partnership with ultimately to embrace healthy lifestyles and to reduce obesity, which in effect will reduce chronic condition. Thank you so much for joining us.